Okay, good morning or good afternoon, everybody. It's Marika Walsh in Ottawa. We have with us this afternoon for a press conference virtually Indigenous Services Minister Patty Hajdu, Chief Medical Officer of Public Health Dr. Tom Wong, and Patrick Boucher, Senior Assistant Deputy Minister for the Health Branch of ISC. We will turn to opening remarks and then over to questions. So over to you, Minister Hajdu.
Thank you very much, Marike. And Kwekwe, hello, bonjour. I'm here today on the traditional territory of the Fort William First Nation, situated in the Robinson Superior Treaty Territory area, and of course, many contributions by Métis people over the years. And I'm so grateful to be here in this beautiful land. Thank you again for joining us this week. We're here to provide an update on COVID-19, on the situation in Indigenous communities, and answer your questions. Je vous remercie de vous joindre à nous de nouveau cette semaine. Nous sommes ici pour faire le point sur la situation de la COVID-19 dans la communauté autochtone et pour répondre à vos questions. I am joined by Dr. Wong, Chief Medical Officer of Public Health, and Patrick Boucher, Senior Assistant Deputy Minister of the First Nations and Inuit Health Branch. Now, we've seen rising numbers of people becoming sick with COVID-19, and it continues to be of great concern to communities, also placing our health and other systems under stress. One of the best tools that we have to protect ourselves, our families, and our communities is to ensure that we're fully vaccinated and that we support others to get vaccinated if they have not already been so. It's clear that vaccination is reducing the severity of disease in individuals and indeed saving lives. As communities continue to work to prevent new surges of COVID, including from the fast-spreading Omicron variant, I've heard the call from chiefs and communities for faster access to financial resources to prepare for outbreaks, implement additional public health measures, and respond quickly to COVID-19 cases to prevent widespread infection. So to help with those efforts, Indigenous Services Canada is flowing $125 million of COVID-19 public health funding directly to First Nations, self-governing, and modern treaty holders across the country to support their ongoing public health efforts. This additional financial support will help First Nations in their efforts to enhance their community surge capacity to protect against COVID-19 infections. Some examples of how the money may be used could include to administer vaccines and boosters or to conduct rapid testing. It could also be used to pay for surge staffing and other resources, food security, or other supports for people in isolation, or updating, reviewing, and activating pandemic response plans. The funding can also be used in a variety of other flexible means in a way that communities determine that will best protect their members. Speed of support matters when a community is under threat of an outbreak, and we will continue to support Indigenous leaders and communities as they work to protect their members. Avec ces nouveaux variants et sa vitesse d'infection, le ministère a entendu les chefs et les communautés parler de la nécessité d'un accès plus rapide aux ressources financières pour préparer et mettre en œuvre des mesures de santé publique supplémentaires et répondre aux éclosions de la COVID-19. Pour répondre à ces besoins, je suis donc heureuse d'annoncer aujourd'hui que Service aux Autochtones Canada versera un total de 125 millions de dollars en financement de santé publique lié à la COVID-19 directement aux Premières Nations, les gouvernements autonomes et les signataires de traités modernes partout au pays pour appuyer leurs efforts en matière de santé publique. Les Premières Nations peuvent utiliser ces financements pour soutenir la capacité d'intervention des communautés alors que le nombre de cas de COVID-19 continue d'augmenter. Par exemple, ils peuvent l'utiliser pour administrer des vaccins et des vaccins de rappel ou pour effectuer des tests rapides. Il peut également être utilisé pour obtenir du personnel et des ressources opérationnelles ou pour de la nourriture ou d'autres mesures de soutien pour les résidents qui s'auto-isolent. Les financements peuvent également être utilisés pour mettre au jour, examiner et activer les plans d'intervention et en cas de pandémie. The money will be allocated using the Indigenous Community Support Fund methodology, and will include an allocation to the First Nations Health Authority in British Columbia. The allocation and its temporary implementation criteria have also included careful considerations for needs of remote and isolated First Nations. The Indigenous Community Support Fund also remains available to Indigenous communities and organizations. This needs-based fund gives First Nations, Inuit, and Métis communities and organizations the flexibility to design and implement community-based solutions so that they can prevent, prepare, or respond to the spread of COVID-19 within their communities. Indigenous Services Canada regional offices and regional medical officers of health across the country remain available to assist First Nations, Inuit, and Métis communities and organizations if they need immediate help with an outbreak or support such as temporary infrastructure, rapid testing, or PPE. Working together, we can protect people from severe outcomes and reduce the risk posed by widespread infections. There are many supports and efforts underway with partners across the country, but I'm particularly grateful to the First Nations, Inuit, and Métis leaders and community members in the communities who are getting vaccinated and helping each other during this difficult time to stay well. It continues to be a very challenging time. Mental health and wellness resources are available if anyone needs assistance. The Hope for Wellness hotline and web chat is available 24 hours a day, 7 days a week, and services are provided in English, French, and upon request in Ojibwe, Cree, and Inuktitut. Please also check out the new Pocket Well app. This is a free tool from the federal government. It's available for download and use as a companion to the Wellness Together Canada portal. Let's continue to support one another and reach out to those around you. And of course, ask for help if you need it. Thank you. And now I'll turn it over to Dr. Wong, Chief Medical Officer of Public Health.
Dr. Wong, you're on mute.
Bonjour. I want to acknowledge that I'm on the unceded territory of the Algonquin people. As of January the 18th, over 1 million vaccine doses have been administered in First Nations, Inuit, and territorial communities. And of those, over 85% of individuals aged 12 and up have received a second dose. Only about 20% of adults have received a booster dose. And over 40% of children aged 5 to 11 have received at least one dose. As of January the 19th, there are 5,097 active cases in First Nations communities. Sadly, there have been a total of 588 fatalities with COVID since the beginning of the pandemic. Le Canada agit rapidement avec les dirigeants des Premières Nations, des Inuits et des Métis, en collaboration avec les partenaires locaux, provinciaux et territoriaux aux besoins pour livrer les soutiens ayant comme but d'amortir l'impact du virus. Je fais preuve d'un optimiste prudent face au fait de voir l'aplatissement de la courbe dans les réserves au niveau national face à la vague de l'Omicron. Canada is acting swiftly with First Nations, Inuit, and Métis leadership, and alongside local, provincial, and territorial partners where needed to deliver supports to blunt the impact of the virus. I'm cautiously optimistic that the Omicron wave may be flattening on reserve nationally if public health measures continue to be optimized. Earlier this week, Health Canada authorized Paxlovid to treat adults with mild to moderate COVID who are at high risk of progressing to serious disease. This is another important tool in preventing hospitalization from COVID. Being optimally vaccinated, including receiving a booster dose when eligible, in addition to all other public health measures, is needed to reduce hospitalization and other severe health outcomes from Omicron and saves lives. Indigenous Services Canada is supporting the My Vax Journey campaign led by Indigenous youth and the National Aboriginal Friendship Center, which includes a recently released public service announcement in 7 Indigenous languages. Be safe and kind to one another. Together, we shall overcome Omicron. Miigwech, Nakumek, merci, thank you, merci. And now I would turn over to the Senior Assistant Deputy Minister, Patrick Boucher.
Tanchi, hello, bonjour. Before I begin, I want to first off acknowledge that I am joining you today from the traditional and unceded territory of the Algonquin people. Comme l'a mentionné la ministre Hajdu, le ministère est présentement dans le processus de déployer 125 millions de dollars en financement direct aux communautés pour un soutien en matière de santé publique. Et ce financement vise à aider les communautés à offrir des services communautaires en matière de santé publique relative à la COVID-19 qui répondent à leurs besoins. Et dans ce cas-ci, fournir un soutien supplémentaire pour aider les communautés à faire face aux effets de la vague Omicron que nous vivons tous actuellement. Et bien que la vague Omicron nous apporte de nouveaux défis, nous continuons avec les partenaires du système à mobiliser des soutiens et des ressources et à être là en partenariat pour soutenir les communautés autochtones dans leur réponse. Mais comme le dit Madame la ministre et Dr. Wong, l'un des moyens les plus efficaces de prévenir les infections graves demeure la vaccination. But as the minister and Dr. Wong have said, one of the most effective ways to prevent severe infections continues to be vaccination. This is nothing new, but is crucial, and we want to continue to get the message out to anyone who is hesitating to please consider getting vaccinated to protect yourself, to protect your family, and to protect your community. I also just want to briefly touch on schools. In the last week or so, in many provinces, children have been heading back to school in person after a period of online learning. And as a parent myself, I know that many parents are concerned with the safety of their kids as they go back to school. Donc, nous continuons à tendre la main et à travailler avec les dirigeants communautaires et les responsables de l'éducation dans les communautés pour nous assurer qu'ils ont quoi qu'ils ont besoin pour le fonctionnement des écoles et que les enfants bénéficient d'un environnement sécuritaire à l'école, qu'il s'agisse d'équipements de protection individuelle, de ressources pour des mesures de nettoyage améliorées ou d'autres besoins, cela demeure une priorité. And lastly, I just want to echo what the minister said and touch on mental wellness. One of the toughest parts of this pandemic for everyone is how long it's dragged on. And this has taken a huge toll on mental health. These are not easy times for many, and we ask that you reach out if you need someone to talk to family, to friends, or to utilize some of the resources that are available to you. For Indigenous individuals, if you need to talk to someone and you feel more comfortable doing it anonymously, as the minister mentioned, there's the Hope for Wellness helpline. You can reach out to them 24 hours a day, 7 days a week at 1-855-242-3310. Or if you'd rather access online supports, you could access www.hopeforwellness.ca. For youth and young adults, there's the Kids Help Phone, and their number is 1-800-668-6868. Again, both of those services available 7 days a week, 24 hours a day. And please remember that it's a sign of strength to acknowledge you need help, because everyone needs help sometimes, especially in stressful times like these. And of course, there are also other mental health measures and supports in communities, such as community-led harm prevention projects and cultural safe wellness teams that are there to support you and to provide community mental wellness needs. There is no doubt that during this surge, some communities have really been suffering. And we want to assure you that our regional offices across the country will continue to be there to support you and to support community efforts and community leadership, which has been tremendous throughout this pandemic. This surge has been difficult and the pandemic has been long, but we must not be complacent And I'm convinced that together we will get through this. Thank you for your time.
Okay, as there are no questions in the room, we will move to the phone line. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Tom Korski, Blacklock's reporter. Please go ahead. À vous la parole.
Thank you. Dr. Wong, you have the worst death rate and the worst infection rate of anybody. The federal prison system is better than your operation. Why is it so high?
Thank you very much, for your question. Indeed, when we actually look at the health disparities, when we look at, the colonization, the trauma, the Indian residential schools, and all the social determinants of health, overcrowded condition, et cetera, all of that contributes, to, the reason why Indigenous communities, Indigenous peoples, are most disadvantaged, and they are most susceptible, to, the severe side effects of Omicron and other variants of COVID-19.
Forgive me, Dr. Wong, just as a follow-up. You have a higher death rate among Indigenous people for whom you are responsible for on health care than Indigenous inmates in federal prisons. You are the worst in the country of any jurisdiction. Forget about colonialism or Champlain. Someone must be responsible for this. You are supposed to have your own personal protective equipment stockpile. You are supposed to be on the job. So who's responsible for this?
We, as a department, support Indigenous partners, Indigenous communities. We provide PPE. We provide vaccine in collaboration with the rest of Canada, other departments, and we provide services in collaboration with provinces and territories in order to support Indigenous communities. Is that enough? No, and I think that it is so important for us to understand that all the social determinants of health and the gaps in services, they must be addressed. Thank you.
Thank you. Merci. The next question is from, la prochaine question est de Rafi Boudjikanian, CBC News. Please go ahead. À vous la parole.
Thanks very much. This question is for the minister. Could you provide more details about the review you committed to in last week's news conference on Jordan's Principle? How are you going to ensure therapists get paid for their services and First Nations kids don't fall through the cracks?
Thank you very much for the question, Rafi. And yes, that's exactly what I've asked the department to do, is to examine the delay in compensation for service providers for First Nations children through Jordan's Principle. And in fact, we'll be setting service standards once I understand what has happened with the delay in these payments. I personally work in and live in Northern Ontario and have met as a member of Parliament a number of service providers who have appealed to me directly as a member of Parliament in the past about more rapid payments. Some of these service providers are sole operators of a small business and, of course, don't have the kind of financial flexibility to wait for payments for a very long time. Perhaps I can turn to Patrick Boucher to say a few more words, but this is critically important to me that people who are providing these services in a timely fashion get timely payment.
Sure. Thank you, Minister, and thanks for the question, Rafi. Just to articulate a bit the process. So after a product or service has been provided to the child, the parent or service provider sends the receipt or invoice to the department, and our payment, and we always endeavor to pay that that invoice as fast as possible, and we're working hard to maintain that that standard and that level of response. And as the minister mentioned, there's always room for continuous improvement, and we're dedicated to look at that. Even with the tremendous increase in volume, which has been roughly 79% increase in the number of invoices processed for the first 6 months of 2021-22 fiscal year when compared to the same period the year before. That said, we have to do better, and we're committed to doing better to make sure that those invoices get rapidly paid. So we're working on that presently, as the minister mentioned, further to her comment last week on this.
Okay, and as a follow-up, can you confirm whether the federal government is going to be giving N95 masks and rapid tests to all First Nations students?
Maybe I can start in a broad overview and then turn to Patrick again to speak a little bit about the work we're doing with communities. There are a number of different ways that communities can access the kinds of supplies they need, whether it's rapid tests or PPE, for a variety of different community needs. However, we want to make sure that no one falls through the gaps, and in particular that students are able to return to classrooms safely and that teachers are able to practice that safely in those classrooms. And so we've put out a call to communities to let us know if there are still gaps in the kinds of supplies that they need for school, for any other essential purpose in the community to protect people from COVID-19. And I'll turn to Patrick to speak about the school situation a bit more closely.
Sure, thanks, Minister. So we've reached out to all of the schools and actually do that on a regular basis. And since the beginning of the pandemic, through the Safe Return to School funding that was provided to elementary and secondary education on reserve. Further to that, the COVID-19 public health funding can also be utilized to meet the needs that communities deem relevant within their own communities and schools. So there's been a lot of work there. And I have to really congratulate the communities for the leadership that they've provided in terms of making sure that there is a safe environment for their children to go back to school. There is those ongoing conversations. As of yesterday, we were reaching out again just to make sure that they have what they need, whether it's on PPE, whether it's on sanitation type measures that they could be enhanced within their schools. So that's going to continue as long as this pandemic continues, to make sure that, again, in partnership with communities, we're supporting them to address the gaps that may exist and that they may uncover. But I'll also turn to Dr. Wong on the question of PPE and testing and the tremendous work that the department has done to ensure that we're providing communities with what they need around that.
Thank you very much, for your question. We work, in locksteps with the communities and the provinces and territories in order to best support all communities, all children in school or outside of school. We set aside supplies of PPEs and rapid tests so that no child is left behind and no communities are left behind. Thank you.
Thank you. Merci. The next question is from, la prochaine question est de Dylan Robertson, Winnipeg Free Press. Please go ahead. À vous la parole. I'm sorry, we are unable to hear you.
We can go to the next question.
Perfect, thank you. The next question is from, la prochaine question est de Christy Kirkup, de Globe and Mail. Please go ahead, à vous la parole.
Hi, thanks for this. My question is for Dr. Wong. I'm wondering, you mentioned that you're cautiously optimistic that there's evidence that the Omicron wave that we've been seeing is flattening on reserve nationally. And I'm just wondering if you could please expand on why there is reason to be cautiously optimistic at this point.
Thank you very much, for the question. Yes, indeed. Over the this week, we've been seeing signs of number of active cases plateauing. And as I actually, mentioned before, right now, as of yesterday, there's a total of just over 5,000 active cases being reported on reserve. Now, that's an underestimation, as we can only understand, because there are individuals, who may be taking the home test, and those results are not captured. However, day after day over the past week, we are seeing, the number of cases flattening, at around, 5,000, to 6,000 range. And we are not seeing, an increase on the number of new cases at this moment. So as a result of all of the public health measures, decisive actions by the communities, with more and more people, including children, getting their vaccines and following public health measures. So at this moment, it's a little bit premature, to say, whether the curve will take another upswing. But based on the information for the past week, we are cautiously optimistic that we may be seeing a flattening of the curve.
Thank you. And just as a follow-up, if I may, I'm wondering if you could perhaps speak to how the threat of this particular wave, and of course we know that Omicron has proved to be much more transmissible than previous waves of the pandemic, how this wave stacks up, if you will, to previous threats that we've seen in the pandemic, specifically for First Nations.
Yeah, indeed. This particular strain, Omicron, indeed spreads very fast. And we see them once it gets, into a community, it can quickly, cause a large outbreak. However, one of the things that, we are seeing, though, is for communities with a high level of immunization with 2 doses or 3 doses, we are seeing that the second and also the third doses in the community able to bend, the rate of hospitalization and the rate of ICU admissions. So, with the second dose or the third dose, it's very effective in protecting, reducing the risk of hospitalization, reducing the risk of ICU admissions and fatalities. And this is something, that is so important. It's never too late, to get, the first dose, second dose, and the third dose, as soon as someone is eligible, because it really makes a difference. Vaccines save lives, in addition to, all of the other public health measures as well. Thank you.
Thank you. Merci. The next question is from, la prochaine question est de Fraser Needham, APTN National News. Please go ahead. À vous la parole.
Afternoon. Hopefully you can hear me okay. The one question you mentioned, and this is for anybody that wants to answer, about mental health, sports, and issues. A couple of stories I've covered that's come up as a big issue, and access to mental health services. And sorry to go on, but one thing that's come up is because Omicron moves so quickly and people are in and out of isolation in small communities, this is creating what's currently starting in Bearskin Lake, that they were telling me some divisions in the community between who's sick and who's not, and things like that. So I just wonder what this is an ongoing issue, but what maybe what extra with some of this money or what are some of the extra mental health supports that the government is looking for First Nations?
Maybe I can just start, and maybe Patrick, you can speak about the extra additional on the ground supports in a case like Bearskin, where there's a significant crisis. The supports that I talked about, and I think that Patrick spoke about as well, are available for everyone, as you know, by phone, by web. Now we have a new app as well that supports wellness together, and I take your point that part of any infectious disease is stigma, and I've even seen it in my own life, speaking to people that have either contracted COVID-19 or recovering from COVID-19 or are feeling some sort of sense of personal shame, and I think people. I would like to tell everyone who's become sick with COVID-19 that you didn't do anything wrong. As much as there are things we can do to protect ourselves, this is a rapid moving virus and people will get sick. And I think compassion is, of a short supply right now. And we need to have compassion for one another. People will get ill. We have medical professionals that are guiding us about what we need to do when we do get ill so we can protect our family and our friends and communities. But it's natural to feel afraid as well of catching the virus. And so that creates a tension that you're talking about in especially small communities where everybody knows everybody. And so in those cases, when there is a crisis that's significant and prolonged in such a severe way, we do have resources available through Indigenous Services to be able to have people on the ground, face-to-face, to support people that can then access those services in even more intimate ways, that can speak with someone, in person. There are also capacities within different communities depending on the circumstance. Patrick, maybe you can speak a bit more about some of those urgent supports that we put into place with communities that are in stress or distress.
Absolutely, Minister, and this is a very huge challenge that we're all grappling with, and that I think through COVID has put a bit of a spotlight on the needs in communities around mental wellness and mental health. So we're working in close collaboration with First Nations, Inuit partners, and provinces and territories to really advance Indigenous-led approaches to mental wellness, and that's really the direction that we need to continue to go in. So there are community-led, culturally grounded mental wellness teams available to communities. We mentioned some of the support lines or the virtual supports in our opening comments. The Inuit and First Nation communities are also have funding for life promotion and suicide prevention, including on the land healing, which often work quite well for communities. We have the non-insured health benefits program and mental health counseling available through that. Of course, Jordan's principle for people, for youth to access the mental wellness supports that they need to get better and to get through these very difficult times, and so on and so forth. But I'll turn to Dr. Wong as well to see if he has anything to add on that. But at the end of the day, this needs to be community-led. Communities know best what their needs are, and they need to be culturally relevant supports to address those needs. Dr. Wong, anything you want to add?
Yeah, indeed, community knows best, and the best outcome is when community leads the efforts, supported, by departments such as ours and others in the provinces and territories. And one of the additional comments I want to actually make is that youth for youth interventions, whether it's through ambassadors, through social media, etc., that's extremely powerful. Youth may not, be well connected, to psychiatrists, psychologists, or social worker. However, with the support of those professionals, and youth can touch another youth, it makes a huge difference. So, supporting our support of Indigenous-led youth organization like We Matter, the Youth Hope Fund, able to actually support youth at the darkest moment of their lives. So thank you.
Grace, just briefly, we have about 20 minutes left. So if there is a French reporter on the line, can we go to them next? And I believe Dylan Robertson is back on the line. So if we could also bring him back into the queue. Thank you.
Perfect. So the next question is from La prochaine question est de Dylan Robertson, Winnipeg Free Press. Please go ahead. À vous la parole.
Hi, thanks so much for Marika, and I'm sorry everyone, that was my fault. I just wanted to ask a bit about the Paxlovid quota. I was wondering how much Indigenous Services is getting both of the total 1 million and also the 30,000 portion, and what is its method for prioritizing the use of this resource?
Perhaps, I will actually, address this question. And perhaps the minister, may want to actually have additional comment. One of the things that recognizing that remote, isolated Indigenous communities with nursing stations, those communities are at particularly high risk for getting complications from COVID, and because of poor access to tertiary care, and as a result of that, those communities are being prioritized, for accessing the initial limited supply, of the Paxlovid. So, with the first shipment into Canada, which is, at this point, 30,000 treatment courses of the product. For those remote and isolated communities, we've worked, with our colleagues at Public Health Agency of Canada, with provinces and territories, in order to prioritize, the allocation and the access of this new medication to Indigenous communities in the north, in remote and isolated communities. At this point, for the initial 30,000, 1,300 treatment courses are set aside for the exclusive purpose for remote isolated nursing stations for high-risk individuals who are at high risk for developing complications and progression to severe infections. And further discussions with provinces and territories, with the Public Health Agency of Canada, with the communities, to actually expand the access as Canada gets the second shipment, the third shipment, and more shipments into Canada. So, thank you.
Thank you. And Minister, could you please walk me through the costing of this top-up to the Communities Fund, how you tabulate the amount to allocate for the current wave?
Thanks, Dylan. I will turn to Patrick Boucher to talk about this current round of funding and how it's tabulated.
Absolutely, Minister. And our teams are working on that as we speak to make sure that we could deploy and push that money out into communities as quickly as possible, to remove some of those barriers, and to make sure that they have the funds and resources necessary to respond as quickly as possible. So in essence, the $125 million that the minister announced earlier will be going out to roughly over 400 communities or partners across the country. There's a $25,000 base for each community, and then further allocations based on population, remoteness, and community well-being. So this is a methodology that's been around since the beginning of the pandemic, and that's been used for the ICSF funding. So for example, a community with over 10,000 in population would be eligible to receive approximately $1 million. A community of less than 1,000 in population, approximately 125,000, and a community of less than 200, approximately 50,000. And I just want to emphasize that communities will continue to have access to further needs-based public health COVID-19 funding over and above this direct formula-based allocation, and communities are encouraged to continue to come forward and work with us if and when those needs arise.
Thank you. Merci. The next question is from, la prochaine question est de Stephanie Taylor, the Canadian Press. Please go ahead. À vous la parole.
Hi. Thanks so much for your time. This question is for Dr. Wong. What areas are you concerned about when it comes to vaccination coverage? I'm not asking for the names of specific First Nations, but are there specific regions where communities have lower vaccination uptakes than you would like? And specifically, where are those in the country right now?
Yeah, thank you very much for your question. Each part of the country, for our Indigenous communities, have some areas where the vaccine uptake is lower, than the general population and lower than other Indigenous communities. In particular, there are communities, where there's a mistrust, of the government, a mistrust of science, a mistrust of the vaccine, because historically, there's experimentation on Indigenous people without consent. One of the things that, we are seeing is, even though, each part of the country has places, where there's a low vaccine uptake, there are places with high vaccine uptake also. It is, through, our pulling together elders and Indigenous physicians, Indigenous nurses, Indigenous leaders and champions, and folks, from those areas where they have a high vaccine uptake, elders, putting together, a dialogue with those communities where there's skepticism, about the COVID virus, and also with, the vaccine. And it's through those dialogue, we're actually seeing that a number of those communities with low vaccine uptake, are actually turning around and embracing the vaccines. And we are seeing month by month, less and less communities, with low vaccine uptake. But as I mentioned, earlier, regarding, the booster dose vaccine, it's still, at a very low vaccine uptake rate for booster at this point, about 20%, of the communities, First Nations, Inuit, and territorial communities together, in adults, that have had received a booster dose. When one deals with the Omicron, the booster dose, it's really important in order to try to prevent hospitalization, ICU admissions, and fatalities. So every opportunity, we can, we support Indigenous leadership to have those dialogues and sharing, their personal and community experience and success stories. Thank you.
And to go off of that, Dr. Wong, have you made any recommendations to individual communities or different health authorities about caution on relaxing restrictions or allowing, more gatherings and public mixing to take place if the uptake for the booster dose is not what you would like it to be to safely do that in the Omicron wave?
Yes, indeed. We have, now is not the time, of relaxing other public health measures, because Omicron, is traveling so fast, infecting both Indigenous and non-Indigenous communities very fast. And one of the things that we've been working with all the communities is to making sure that, the message, is there. At this point, relaxing public health measures, will really end up inviting the virus to enter into communities and infecting more and more people and sending some members of the communities to the hospitals. We don't want that. There is light at the end of the tunnel, but not now. Now is the time to continue and redouble our efforts on public health measures, including increasing the vaccine uptake rate to protect the elders, to protect those in long-term care facilities, in elders' lodges, to protect pregnant women, the very young, to protect the vulnerables in the community.
Thank you. Merci. Once again, please press star 1 if you have a question. N'hésitez pas à appuyer sur étoile 1 pour toute question. The next question is from, la prochaine question est de Leonard Monkman, CBC Indigenous. Please go ahead, à vous la parole.
This question is for Minister Hajdu. I talked to Chief Sheldon Kent from Black River First Nation. They declared a community outbreak yesterday. The chief told me that there aren't enough rapid tests in the community. Can you give me an update on what ISCA is doing to provide rapid tests for Black River and other First Nations that are experiencing outbreaks? Thank you.
Well, thank you very much for the question, and I'll actually turn to Patrick or Dr. Wong to speak about this, as they'll be more actively involved.
Absolutely. So maybe I'll start and then I'll turn to you, Dr. Wong. As we've mentioned on several occasions, we are in continuous contact with communities. As needs arise, we mobilize along with partners, system partners, to ensure that the community is getting what it needs to combat the virus, whether it be testing, whether it be other supports. In this case, for testing, we will follow up with Black River. We have, on many occasions throughout the pandemic, mobilized surge capacity around testing into communities very quickly. We've established a very sophisticated network across the country to ensure that those very valuable tests are close to communities to be able to very quickly deploy them. And that's over and above the tests that already exist within the community. So I'll turn to Dr. Wong to maybe elaborate more on the different kinds of tests and testing technologies that we have in communities. Thank you.
Yeah, there are a number of molecular tests that we have provided to communities or close to the communities, so that they don't have to travel outside of the communities for long distance, for hours in order to get a test. And also working together with Public Health Agency of Canada, help support the training of members in communities in order to run those equipment so that they could actually have a rapid turnaround time. And some of the tests you've heard about the Gene Expert, the molecular test, or ID Now, and those are tremendously helpful, cutting down on the turnaround time, and also reduce the need to actually make long trips to urban centers in order to get those tests. In addition to that, we also have been providing, when needed, rapid antigen tests, that individuals, can actually use at home in certain circumstances, such as an outbreak, situation. And whenever there's a need, we work with the provinces and territories, to make sure that no communities are left behind. So our regional team, will reach out to the community and community leadership to actually make sure that their needs, whether it's for rapid tests, or for PPEs or for others, that they have everything that they need in order to deal with the outbreak in the community. Thank you.
Just a quick follow-up question. Another common theme that I'm hearing from First Nations that are experiencing outbreaks. Some of the leaders are saying that overcrowded housing is one of the main issues for extended outbreaks. Are there plans to fund homes in First Nations like Sandy Bay, which has been dealing with a month-long outbreak, as well as places like Black River, which also said that housing and overcrowding is an issue?
Maybe I could take this. First of all, Yes, I mean, Dr. Wong has been very clear that the rate of infection and poor outcomes for Indigenous people are connected to social determinants of health, including access to affordable and appropriate housing. Overcrowding, as we know, makes it very difficult to contain the spread of COVID-19 from family member to family member when even just one person tests positive for the disease. But it's not just COVID-19, it's other diseases that are spread quickly and rapidly through households, like, for example, tuberculosis that many First Nations communities have struggled with for a very long time. That's related in part to overcrowding as well. So from my perspective as Minister of Indigenous Services, it's my job to fight for Indigenous people and to fight to make sure that the appropriate resources are in place so that we more quickly can build the houses that Indigenous peoples need to more safely accommodate people in communities, and that's exactly what I'll be doing.
We have time for one more question.
There are no further questions registered at this time. Nous n'avons plus de questions pour le moment.
Okay, thank you so much. If I could just ask for my French colleagues, in case they need it, if Dr. Wong or Mr. Boucher could please repeat in French the why you are cautiously optimistic that the wave has plateaued or is peaking, and also on whether now is the time to lift restrictions. That way my French colleagues can also have some quotes. Thank you.
Perhaps, I'll start first, and Patrick may want to actually, chime in. Maintenant, ce n'est pas le temps pour relaxer les mesures de la santé publique parce que le variant Omicron traverse et court vite. Et il est très, très important pour protéger les elders, les jeunes et les enceintes et les membres de la communauté qui sont très vulnérables. So with that, I'm going to turn over to Patrick and see if he has anything else to add.
Merci beaucoup, Dr. Wong. Simplement pour ajouter que notre priorité absolue est la santé et la sécurité des Premières Nations, des Inuits et des Métis. Et nous sommes tous résolus à soutenir les collectivités dans leur lutte contre la COVID-19, de concert avec les dirigeants, les organisations autochtones et avec les gouvernements provinciaux et territoriaux. Et les conseils et les directives des autorités canadiennes de la santé publique concernant la COVID-19 changent rapidement à mesure d'évoluer, à mesure qu'évoluent les données probantes sur le virus et notre compréhension de la COVID-19. Donc, comme Dr. Wong l'a dit, ceci n'est pas le temps de réduire nos efforts et nous sommes résolus à continuer d'être là pour nos partenaires et les communautés autochtones. Merci.
Okay, thank you all so much. Have a great day.